Swelling after a tummy tuck, what should I expect? The reality is soft tissue of the human body, especially specifically after a tummy tuck, is going to cause swelling. The lymphatic architecture of the soft tissue of the abdomen is absolutely destroyed. It is completely destroyed. And the lymphatics are really the sewer system of our body. It takes all that extra rainwater, like in a city, that you see when it rains really heavily, and all that water backs up in the streets. This is this analogy. That water has to go somewhere. And so basically what I did as a surgeon, I completely destroyed the sewer system. And so all that water backs up in the streets, into yards, and it has nowhere to go. And so after tummy tuck, all that lymphatics has to be reconstructed and rebuilt. So it takes time, people. I cannot tell you, it takes time. You cannot expect to look like permanently how you're going to look like a week after your surgery, 3 weeks after surgery, or 2 months after surgery. You will not be 100% recovered from your swelling. It does not work like that. We have things to make swelling go faster. We do compression therapy. We downsize garments. Get you into massage therapy. Please do massage therapy. That really helps the human body reconstruct the lymphatics, get that swelling go away faster. And then in 2 months, all my tummy tuck patients, and those of you who are out there who've had are my patients, I've told you this. You can almost quote me word for word. At 2 months, you're about 60% recovered in your swelling. You still have another 40% to go, and that takes another 4 months. So 6 months, you're like 90% done as far as your final swelling outcomes after a tummy tuck. Will it happen without garments or without massage therapy? Yes, it will. It absolutely will. It will take you, 6, maybe a little bit longer, but it will happen. But everyone now wants things to happen immediately. So everyone is impatient. That's just the way it is. I'm impatient as a surgeon. All surgeons are guilty is that we want immediate satisfaction. I want it now. And this is just one of the aspects of surgeries that we have to wait. You have to let your body heal. You can optimize your healing process. You got to eat well. You got to drink a lot of water. Take healthy vitamins. Stay away from smoking. Like all these little things add up cumulatively to heal faster. So surgeons talk to you about this. There's a reason we're telling you these things. We want you to heal faster. We want to make you happy. We want you to have those results faster. If you have a long day activity and you're out at the Houston Rodeo all day and you're eating funnel cake and you're eating a turkey leg, all that just the overactivity out in the humidity, Texas humidity specifically, you will feel even more swollen. A long day of sitting at work. If all you do is sit all day, by the end of the day, I guarantee you, you'll be swollen in your lower abdomen. It's going to be uncomfortable in the first 2 months. You might be a little more achy. That's your body telling you, hey, my skin is tight. It's from the swelling. That's what it is. But it will get better. You just have to be patient with it. It really takes 6 months to have all the swelling resolution normal at 6 months. Great topic. I love talking about this topic. Hopefully people who are out there considering tummy tuck have gotten this information from me and can understand the conversation with your surgeon when you decide to have a tummy tuck. So again, thank you for watching. Hope you learned something. And don't forget, like and subscribe. Stay tuned for more. Thank you.